I am now pleased to introduce our first speaker, Dr. Kathleen Pike. Dr. Pike is a professor of psychology at Columbia University and serves as the director of the Columbia WHO Center for Global Mental Health. She brings extensive experience and expertise to this topic, including her work designing and delivering mental health services in fragile and post-disaster settings, and a recently announced partnership with Maybelline New York to confront mental health issues and stigma. We are so grateful she is with us today to share her work and perspective. Kathy?
Thanks so much. It's really a pleasure to be here, and I appreciate the opportunity to join the discussion. So why does mental health matter in the workplace? Mental health has always mattered in the workplace. We know that mental health is significantly associated with productivity and work performance. We know that good mental health is associated with reduced absenteeism, turnover, and injuries. We also know increasingly that the extent to which companies pay attention to mental health and well-being of their employees is associated with enhanced reputation, recruitment, and retention. And it is very clear that mental health is very much centrally associated with other health conditions that are relevant to employees, including things like diabetes and heart conditions. So that's always been true. What's happened now is, I'm just waiting for the next slide, is that with COVID-19, we've got a range of significant new stressors or exacerbated conditions that in our research have emerged as the most significant variables associated with the rising mental health symptoms. The 10 COVID-19 stressors that are most relevant from our work looking at mental health and work during COVID-19 have to do with the very high levels of ambiguity and uncertainty associated with the pandemic, the overwhelming amount of COVID-19 related information in the media and the conflicting information. The third point, the real risk of infection, is a very significant stressor. The fourth stressor related to physical distancing and the associated social isolation have very serious mental health repercussions. Fifth variable is the change in work demands, work structure, and processes. This has varied significantly depending on the type of employment that someone has, but each of those has significant risk in terms of mental health. Increasing the changes in domestic responsibilities that increase stress or impede work, and in particular the issues around work from home and the impact of for employees who have children who may or may not be in school or have older parents who may or may not be living with them or in senior residences has put significant stress on employees. Of course, having a loved one with COVID-19 or losing a loved one, and studies are showing now that given the rates of individuals in the U.S. who have died from COVID-19, that we literally have over 2 million Americans who are grieving right now, having lost a parent, a child, or a partner. The financial concerns and job security are associated with significant concerns and worries that increase mental health risks. The worsening of comorbid long-term health conditions that are being impacted by reduced access to care or concerns about seeking care. And then 10th, there are significant increases, employees are reporting significant increases in terms of privacy and confidentiality, with employers now tracking where they have been, who they are in close contact with, etc. When we look at what those stressors translate into in terms of stress, a few significant numbers. An estimated annual cost of mental ill health to our U.S. economy is $260 billion. 96% of all U.S. adults say the pandemic has impacted their overall stress. 80% of respondents, when we look globally, 80% of respondents in India felt the need for increased mental health services and access. 42% of respondents in the UK report significant increases in terms of fatigue due to the lockdown. And the bright side of the story is that we know that if we invest in employee mental health, for every dollar invested, we have a return of $4. So it's a really good investment, especially at a time of these increased risks. Within the U.S., the most recent data from the CDC indicate that about 40% of American adults report struggling with mental health issues, that the common mental health issues are around anxiety, depression, trauma-related risks, increased use of substances, and even some increase in terms of suicide. These increases in symptoms have led to major headlines that I'm sure many people have seen in the media around a warning about the next pandemic and the shadow pandemic of mental health. And what I want to say loud and clear here is that the elevated rates of mental health concerns are very serious, but a mental health pandemic is not inevitable. What we can learn from the data from what we want to consider here is that elevated symptoms are not mental health disorders. And in fact, when we think about people reporting that their increased rates of anxiety or fatigue or concerns about employment or trouble sleeping, those are pretty normal responses to a very serious global pandemic. These are feelings that alert us to the seriousness of the problem and even motivate us to do what we need to do in response to a very real problem, like wearing masks and avoiding large gatherings and so on. Normal, appropriate emotional responses that we can consider signals, in the same way that feeling when we go outside and it's cold, we put on a coat in the winter. It tells us that we need to bundle up, right? The key consideration here is not that people are feeling increased symptoms. The question is, what's the severity of the symptom, what's the duration, and what's the impairment? And when symptoms become extreme in terms of severity, when they endure over significant periods of time, and when they interfere with daily functioning, that's when we know it's time to intervene. So what do we know from other public health crises? This slide shows us some data from two different moments in history that offer some guidance. The first row here looks at the mental health sequelae after 9/11. What was the prevalence of post-traumatic stress and related mental health conditions after the September 11 attack in Manhattan? 1 month after September 11th, the rates of mental health concerns were significantly elevated to 7.5% of New Yorkers reporting increased levels of mental health problems. But 6 months after 9/11, rates had gone way, way down. another point of reference for us is to look at the second row of data, which represents information around mental health from epidemics and widespread public health crises from the 21st century, including pandemics and epidemics of SARS, Middle East respiratory syndrome, Ebola, and swine flu. And what we see here from these data, from a review of these data, is that immediately after an epidemic or pandemic, we see significant range in terms of mental health response. And unlike 9/11, even a year later, there are significant elevations, but also very significant range. So the takeaway here is that when we have these health conditions, these major public health conditions, we're going to see a very wide range of response, and we're going to see that the response has more of a lasting impact. Who's at most risk, and what accounts for some of that variability? What we want to keep in mind is that the individuals who are going to be at most risk for the mental health, elevated mental health issues are those who have pre-existing conditions, the intensity and severity of exposure, and the amount of support that they have from within their community and context. Those factors are going to mediate the mental health response. So what can leaders do during this time? Our data show that leaders play a very, very significant role, have an outsized opportunity in terms of shaping the organizational response and impacting the mental health outcomes. 8 key steps for leaders: communicating clearly and often, making mental health a normal part of the conversation, recognizing that it is part of this pandemic. Leaders have an opportunity to facilitate peer and team support. Leaders have an opportunity to promote and model flexibility that will be essential given the stressors of this enduring pandemic. Leaders need to support open two-way conversation, not only reporting out, communicating out, but creating channels to hear back from employees, especially given the way in which teams and workforces have been fragmented. Leaders have the opportunity to normalize employees' heightened anxiety. Leaders have the opportunity to remind employees about the importance of mental health. And 8, have an opportunity to promote and model self-care. When we talk about organizational strategies, we often in our consulting work with organizations, you talk about the 3 Ps. Leaders have an opportunity and an obligation to protect employee mental health, to promote positive mental health, and to provide access to appropriate care. What do we mean by protecting mental health? Leaders have the opportunity to do there is prevent exposure to undue stress and situations that could cause mental health symptoms and problems. Right now, that includes things like creating flexible work hours, addressing family leave needs, cultivating a culture of trust. Those are protective strategies to reduce mental health symptoms. Leaders can also promote good mental health that enhances skills, resilience, and coping. What does that look like today? It looks like creating routines and structures amidst uncertainties. It means building peer support groups. It means skills building workshops. It means modeling self-care. That's a strengths-based approach that makes an enormous difference at times of enduring stress when individuals are at risk for mental health symptoms. And then third, leaders need to provide opportunities for employees to talk about mental health needs and to access care as needed. What does that translate to today? Knowing what's available within your organization, facilitating connection to resources for employees who are struggling with mental health concerns, and expanding resources as needed. What's critical at this moment, which is critical always, but especially at times where there are increased stresses, increased uncertainty, increased ambiguity, increased needs, and increased efforts, it is all the more important that leaders are very, very clear about the problem that you are trying to solve for right now. What are the mental health issues in your organization? Define the problem clearly. You need to articulate success. What will success look like if you address the mental health problem? Make sure you measure and learn, innovate and iterate, and then go back to defining the problem. The biggest mistake that we see at times like this is that programs get developed without clarity about what the real problem is and what success really looks like, and the result is significant efforts without clarity of outcome, and then we don't know that there's really been desired impact, and we just can't afford that at the moment. So the takeaways for today in terms of our big picture is that mental health consequences of COVID-19 are vast and serious. The shadow pandemic is absolutely not inevitable. Fortune favors those who prepare, and there are ways that organizations with strong, clear leadership can address the mental health needs so that employee mental health is protected, that employees' positive mental health is promoted, and that for those individuals who have more serious mental health needs, appropriate care is provided. Employers have an enormous opportunity to support employee mental health during and beyond COVID-19, and I look forward to hearing from my fellow panelists about the work that they are doing to address mental health in their organizations. Thank you very much.
Great. Thank you, Dr. Pike, for giving us some background on common stressors that we are seeing, providing such thoughtful context around how the pandemic is impacting mental health for workers in the United States, and exploring what can be done to help avoid a mental health pandemic.